articles that are being written on financial literacy. And there was one that went out on Sunday, and it referred to the 4 ways to improve your financial literacy. And so I have some bullet points down to the bottom, and this article is basically identifying different ways for improvements. The first pointer is to identify your knowledge gaps. So what does that mean? So all of us have general knowledge. It's what we don't know sometimes is what tends to hurt us when it comes to improving our finances. And so there are a number of tests that are available. Some websites will provide as much as 30 different tests that you can click on to learn about student loans, investing, webinars that are available. But in addition to these, the idea is to glean knowledge and to improve in areas that we are not as astute in. So let's keep testing. On average, surveys say that most Americans average a C in terms of their financial literacy. So there's always room for improvement. The next one is to find a trusted source of information. So there's lots of resources out there, but which ones do we actually trust in terms of accuracy of the information? So we want to find textbooks that may have been written and utilized for a number of years that have best practices. There are also at this point different websites and news outlets that continually provide information. What's key here is not making emotional decisions and being able to trust the information that we get and rely upon sourcing that to a second person. So bullet number 3 is understanding how you best learn. All of us retain information differently. And so we want to ensure that how we learn and how we go about getting the information that we learn is best suited for us. So some individuals are audible learners, some are more visual where they learn from charts and graphs and so forth. And so we want to find what's our best way and then begin to put a plan together of studying, of gathering information that's going to help us along the rest of this year and through our COVID experience. The final bullet is all about establishing good behaviors and practices. And by that, what the article is referring to is sometimes our behaviors don't match our actions. So we have to be very intentional about sticking to our plan. What does that mean? That means if we come up with an idea of eliminating debt, perhaps we have to take the first step, which is creating auto pay on some of our bills that we have, or even just staying on top of our credit cards on a regular basis. So again, there are tons of articles out there during the month of April. I wanted to share some of these best practices and tips that this article shared and encourage everyone to continue developing your plan now. So let's go to the next slide. The purpose of our workshops, and this is something that I've been sharing all along, is simply to create awareness, to bring that level of information and the importance of financial literacy to the forefront. I also want to discuss the need for effective financial education, pardon me, in light of the federal stimulus checks to the public. This particular workshop is going to provide guidance and direction toward relief services available to the capital city. And so our next slide is going to do a breakdown of our various parts, and I'll explain what the 4 different areas of content. So part 1 is social services programs. Part 2 is food and employment services, which will be shared by Hope Ministries. Part 3, we will go over legal services. And then part 4 will be our Q&A, our question and answer session. So now that you know the content of what we're sharing, you understand financial literacy, today is all about giving you the support services and the resources that you need if you're having financial difficulties or you need some support in various areas. So let's get started. Presenting partners. So today with us is our Human Development and Services partners, Ms. Shamel Levine, Ms. Danette Brown, and Ms. Nina Hunter. All program directors will be providing information for us. The next partner is Southeast Louisiana Legal Services. Laura Dugal, who is with us today. She is the executive director. She will be providing helpful information about their nonprofit. Hope Ministries of Baton Rouge, Janet Simmons, president and CEO. Janet has been with us and some of her support staff on our previous workshops, and we're glad to have her back with us today. And then finally, from the Office of the Mayor President, I'll be presenting and going through our Q&A with all of you at the end. So let's begin with our first section, part one. The Division of Human Development and Services, DHDS, is present today. Ms. Shamel Levine will begin the presentation representing Office of Social Services. Ms. Danette Brown will be followed representing Ryan White, and then Nina Hunter for Employ BR. At this time, I would like to turn the presentation over to Ms. Shamel Levine, and Shamel will begin the presentation sharing information, particularly about the Office of Social Services. She is an executive program administrator with DHDS, the Office of Social Services. Welcome, Shamel.
Good morning. Thank you, Dr. Jones. The Division of Human Development and Services is a social services branch of City Parish. This morning, we will provide information on 3 of the 4 programs that we offer under DHDS. Office of Social Services, Ryan White, and Employ BR. I will provide information on our Office of Social Services, which is our community action agency for East Baton Rouge Parish. Our community action agencies are tasked with addressing poverty in our community. And if we can go to the next slide. So in order to address poverty in the community, we administer community services block grant funds, also known as CSBG funds, to provide rental, mortgage, medication, and food assistance. We also receive low-income home energy assistance program funds, also known as LAHEAP, to help with utilities. Another program provided is the Housing Opportunities for People with AIDS program, also known as HOPWA. HOPWA provides short-term rental, utility, and mortgage assistance for people living with HIV. It's currently the only program that we're assisting clients with remotely. If clients are able to bring in their documentation, or not bring it in, but email or fax their information to our HOPWA case manager, we're assisting with mortgage and rental and utility assistance for individuals living with HIV. We also provide free income tax preparation services through our VITA program. Due to COVID-19 and in alignment with the governor's stay-at-home order, we're currently closed to the public. All scheduled in-person appointments have been postponed until further notice. However, the IRS has extended the tax filing deadline from April 15th to July 15th. And we're expecting to resume tax services sometime in maybe mid-May. In addition to what we're preparing for, we're also working on getting staff members the tools needed to work remotely to provide assistance while ensuring their safety as well as the community safety. So we're, getting laptops and iPads and cell phones so that our staff can work remotely from home. To do that, we are also implementing 2 systems, one to schedule appointments electronically, and the other to conduct case management services via teleconferencing to provide services remotely. Staff are currently being trained on how to navigate the automated systems. And so clients will be able to apply for assistance 24/7, 24 hours a day, 7 days a week online. A tutorial will be provided so that clients can navigate the system easily. In addition, we're putting a plan in place to provide assistance for CSBG, LAHEAP, HOPWA. As I stated earlier, for HOPWA, as with HOPWA, clients will have to submit eligibility documents via email or take pictures of their documents on phones to send to family service workers. We're also looking into purchasing a drop box so our seniors, disabled citizens, and those unable to email, fax, or text can drop documents off while maintaining social distancing. And the slide that's currently on the screen is regarding our income guidelines for CSBG. Currently, the income guideline for CSBG is set at 125% of the federal poverty level. This slide shows the annual amount someone can make to qualify for assistance. So if you look at the second column, under 125%, a household of one can make up to $15,950 to qualify for rental, mortgage, or medication assistance under CSBG. We are expecting to receive CARES Act funding, which would increase our income guidelines to 200% of the federal poverty level. This change will increase our capacity to assist more clients. And we're also hoping to provide additional services, additional access to food and other essential items through our CARES Act funding. Under the CARES Act funding, like I said, it'll be at 200% of the federal poverty level. So if you look at column number 3, under 200%, someone who, if there is one person in the household, the income limit will be $25,520. And if it's a household of 4, the income limit will be $52,400. Documentation needed for rental and mortgage assistance under CSBG would be a valid ID of the head of household, Social Security cards for every household member, proof of income for every household member, a late rent or mortgage notice or eviction notice, and proof of hardship, and a proof of all household expenses. For medication assistance, we would need all of the documentation just listed and a copy of a prescription or proof that the medication is needed. Next slide, please. We're also putting a plan in place to provide utility assistance through LAHEAP. The income eligibility guideline is based on 60% of the estimated state median income. So for a household of 1, the monthly household income limit is $2,011. For a family of 4, it's $3,868. We are unsure if the income guidelines will be relaxed when the CARES Act funds are received. More information on when we will be providing energy assistance and how to access assistance will be forthcoming. Next slide, please. So, like I said earlier, just as a recap, individuals will be able to schedule appointments electronically via phone or computer. We will have online applications available 24 hours a day, 7 days a week. A tutorial will be available to ensure easy navigation of the system. And we are going to implement a drop box located at our main office, which is located at 4523 Plank Road. So it will be available for seniors and disabled citizens to drop off necessary documents if they are unable to access the application online or upload their documents. Just as a reminder, our office is close to the public. Staff is working, some staff are working on site and remotely to meet your needs. And we're going to be processing applications by phone, email, and fax. And so at this time, I would like to pass it on to Danette Brown, our Ryan White Program Administrator.
Good morning, everyone. Thank you, Shamil. My name is Danette Brown. I'm the Ryan White Program Administrator. So the Ryan White Program is a program that provides relief services to individuals and persons living with HIV within the Baton Rouge Transitional Grant area. We service 9 parishes within the area, and it is for people living with HIV who are uninsured or underserved by the current medical system. Next slide, please. So the Ryan White Program provides a comprehensive system of HIV primary medical care, which includes substance abuse, mental health services, medical case management, and early intervention services. It also provides essential support services, which includes housing, transportation, emergency financial assistance, and assistance for support groups, and medication for low-income people, living with HIV who are uninsured and underserved. Next slide. The program funds grants to local community-based organizations and clinics to provide care and treatment services to people living with HIV to improve health outcomes and reduce HIV transmissions among hard-to-reach populations. So in order to qualify for the Ryan White program, in addition to documentation of HIV diagnosis, you will need proof of residency in one of the 9 parishes in the Baton Rouge Transitional Grant Area. And so these parishes include Ascension, East Baton Rouge, East Feliciana, Iberville, Livingston, Point Capee, St. Helena, West Baton Rouge, and West Feliciana. So you must have an income of no more than 300% of the most recent current federal poverty guidelines. And so the exception to that is individuals accessing medications must have an income of no more than 400% of the most current federal poverty level. If you're a current Ryan White client, these eligibility guidelines have been relaxed during the COVID-19 pandemic, and clients can self-attest to documentation of HIV, proof of residency, and income over the phone via text message, email, or through your case manager. Next slide. So what is the Ryan White program doing for COVID-19 response? So the Ryan White program has received CARES Act funding. On April 15th, the U.S. Department of Health and Human Services, through the Health Resources and Service Administration, also known as HRSA, awarded $90 million for Ryan White HIV/AIDS program recipients across the country to prevent, prepare, and respond to coronavirus disease. So what we're doing for our client services for prevent, the Ryan White subrecipients promote prevention practices and administer countermeasures to reduce risk of COVID-19 among Ryan White clients. So some of the preventive measures that are taking place are providing PPE equipment to clients when they enter our clinics or our community-based organizations. Prepare, enhance readiness, training, and services to respond to COVID-19 for Ryan White clients. And part of preparing clients for COVID-19 is helping our clients to get a safety plan in place, helping them to access additional services that they may need, and also preparing our organizations to be able to work remotely, which includes telemedicine and infrastructure readability in order to provide services to those in greater need. Respond. And so under responding, we're able to assess, test, diagnose, treat, and limit the spread of COVID-19 among Ryan White clients. So our Ryan White funded agencies will be able to test clients that are funded through the Ryan White program with COVID-19 test kits so that we will be able to treat them as soon as possible or provide any self-isolation measures. Next slide. So our current Ryan White HIV funded partners are Care South, Crescent Care Legal, who are able to provide any type of legal services for clients that are enrolled in the Ryan White program or Ryan White eligible. At this time, clients who are Ryan White eligible do not need to have a referral in order to go to Crescent Care Legal Services. You are able to self-refer. And so Crescent Care is able to help with legal matters at this time regarding evictions, unemployment processing claims, or any other legal issues that clients may be having. Family Services of Greater Baton Rouge, HIV/AIDS Alliance for Region 2, also known as HART, Open Healthcare Clinic, Our Lady of the Lake Mid-City Clinic, and Volunteers of America Greater Baton Rouge. So please contact those agencies if you're a Ryan White eligible client, and you can obtain more information about the services, the relief services provided during COVID-19 pandemic. At this time, I would like to pass the slides over to Nina Hunter, Program Administrator for Employ BR.
Good morning, everyone. Thank you for having me. Again, I'm Nina Hunter, and I'm with Employ BR. Employ BR is the local workforce development wing of the city. We administer WIOA funds, which flow from the federal government through the state and down to the city. What that means is we're able to access federal dollars to spend on individuals that will be eligible for our services. Our services are divided, or essentially we receive 3 different funding streams. Those streams are youth, adult, and dislocated worker. In order to be eligible for our services, there is an application that has to be filled out, and certain documents have to be attached to the application in order to be eligible. To get more specific information about the application and how to apply, I'm going to refer you to our website at employbr.com. But in the meantime, let's talk about how you can be eligible for services. Under our youth funding, under our youth program, our funds are divided into 2 categories: in-school youth and out-of-school youth. Our in-school youth are between the ages of 14 to 24 years old. There is an income eligibility requirement, which means you have to be at 100% of the federal poverty guideline. And that's usually right at about $12,000 for one person. And you also must have a barrier to employment. A barrier to employment is parenting, pregnant, and being in foster care, have aged out of foster care. You may be basic skills deficient. You may have a juvenile record or adult criminal record. English may not be a first language. So in most instances, it's a situation where there's something that may be contributing or hindering you from entering the workforce or making it harder for you to enter the workforce. That is what we define as a barrier. If you have one of those categories, that will help place you or qualify you for services through Employ BR. Our out-of-school youth funding are essentially youth between the ages of 16 to 24 who are out of school and also have a barrier. So one of those same barriers includes not having a high school diploma or being in a alternative or GED or high set program. And then one of those other barriers that we talked about, parenting or pregnant or being homeless is also a barrier, being in foster care, being basic skills deficient. Our next funding stream is adult funding stream. That's 18 years old and up in order to be eligible for that category. So of course you see that there could be some overlap. A person could be deemed eligible as a youth or as an adult, and that gives us flexibility in determining, what services will best fit that individual. If an individual is low income, but they don't have one of those barriers that I mentioned before, we could deem them eligible as an adult, and they could still access Employ BR services. They still also must be income eligible under our adult funding stream, and again, that's right at 100% of the poverty guideline. A good measure for that, or one of the qualifiers that we are able to use through WIOA funding, is if you receive SNAP benefits or TANF benefits, that is an automatic indicator that you'll be income eligible for our program. The last category, which I think is really applicable right now, is our dislocated worker funding stream. Normally, we don't have a lot of applicants apply for this, but as a result of the COVID-19 pandemic, individuals who have been laid off by an employer and eligible to receive employment benefits and is not likely to return to that same industry could be eligible for service for our dislocated worker program. So individuals, we know that there are a lot of people who have been laid off and receiving unemployment benefits. Well, that's 2 of the requirements. The last requirement, if I can justify that you're not likely to return back to the industry that you are currently working in, one of the indicators of that is that you've been on unemployment so long that you've exhausted your benefits. That's an indicator for our purpose that says, hey, you're not going to be likely to return to the previous industry. You can come into Employer BR and access our services. In most instances, a dislocated worker will probably be looking for training so that they can jump into a new career field if they're not interested in staying in the one that they're currently in. It also applies to individuals who have been laid off from a business that has permanently shut down. We've seen a lot of information in the news and the media about companies that have closed temporarily. If that company is planning to open back up again, then that wouldn't be a qualifier for a dislocated worker. But if it was a permanent closing or a substantial layoff where they've laid off a large number or percentage of individuals from their staff, then that could be an indicator for us, for individuals to come and qualify for dislocated worker services. I think it's worth mentioning also, as you can see from the slide, that there is no income eligibility under dislocated workers. So we're not dealing with individuals who are under who meet a certain poverty guideline. These are individuals who have been working in, high-paying fields and industries could essentially access these services. Dislocated homemaker, sometimes a lot of people not really sure what that means, but that is essentially a situation where there may be a husband who was the primary breadwinner for the family, but something has happened to the husband. Maybe he has become disabled, or for some reason he cannot work, and now the wife or the other spouse in the home has the charge or the responsibility of now returning to the workforce. So in that instance, the dislocated homemaker standard would qualify individuals to receive services or benefits. So once you've cleared those categories for becoming eligible, now I'd like to tell you about what that means. Next slide, please. So Employer BR services are very wide ranging. First, our on-the-job training. We like to talk about this program because it highlights, or is a twofold benefit. It's a benefit for the employer and it's a benefit for the employee. For the employer who's partnering in that OJT opportunity, we pay, meaning Employer BR will pay up to 50% of the salary of an individual to work in a certain industry. And of course, you can see the benefit for that employer. So that gets an employer to come to the table in a manner that they may not have come before and be willing to hire an individual where we're bearing half of the risk of, is this person really going to be employable? Are they going to be viable? Are they going to be a good asset to the team? These contracts usually last about 6 months. And when it's over, the employer offers full-time permanent placement to that individual. So you can see it's a win-win on both sides. Employer BR kind of stands in the middle and help put those two individuals together. We also host hiring events. So it's very, very lucrative for individuals who are looking to return to the workforce, to stay in contact with us. Employers reach out to us most frequently and ask us to assist them in hosting hiring events. So again, twofold win for individuals who are looking for placement and for employers. Employer BR can literally stand in the gap and connect those individuals. So we have a lot of information on people who are looking for employers, and two, we can connect you to those employers. Individual training accounts is probably one of our most popular features because we can pay the tuition costs for individuals to go to school. We have a list of training providers that we contract with in multiple trades and multiple industry fields, and we will pay the tuition for our customers to get that credential, and then of course assist with placing them back into the workforce. So that includes Southern University nursing program. It includes many programs at our technical colleges, including BRCC and River Parish Community College. It includes local driving schools such as Coastal, Diesel, several CNA programs. So a pretty varied list of training providers. So most of our customers, when they come in, they're interested in getting that credential, and we can pay the tuition costs for them getting there. Our Youth Work Experience program, also very popular. That is a partnering program with businesses, local offices, businesses, industries in the local community. Essentially, we will pay the full cost of wages is $10 an hour to youth, which means those individuals in between that 16 to 24 or 14 to 21 category to get work experience. So that we place the youth at a work site, they get the mentoring, they get the guidance, they get the soft skills, and we pay the salary. And that's a very popular program through Employer BR. And again, it's twofold win because it serves the public and it also serves the employer. Career counseling is, is what it sounds like. We have a team of certified workforce development case managers. We've been trained in career counseling to provide assistance for individuals who need guidance in setting their careers. Support services is also a huge mechanism. One of our really just most needed, we are allowed to spend money on support services to help individuals who have barriers to employment. So what does that mean? That means assistance with childcare, that means assistance with transportation, that means assistance with purchasing uniforms, tools, any of those vital needs that a person may have or need that's hindering them from being able to be successful or enter the workforce. We can trigger these WIOA dollars to access those services. Our resource center also going to have to obviously revisit how we provide that service, but normally you would be able to access Employer BR, to use computers, fax machines, copy machines, printers, all of those things that members of our community normally don't have at home. They need to be able to access it. They can do it for free and come right into our center without appointment and access those services. Obviously, we'll be revisiting how we handle access to the resource center in regards to the COVID-19 situation. Our offices are currently closed to the public, but our case managers are still working, serving our current customers. We will be providing notice or information on when we will be able to begin receiving new applications for services. But our address is 4523 Plank Road. The phone number is 225-358-4579. You can call there right now and ask specific questions about our services. And of course, we refer you to our website that we are updating frequently so that you will know when you can start reapplying for our services. Next, I'm going to turn it over to our next speaker.
Nina, thank you. And thank you to the other program administrators from DHDS that presented. When we get into our Q&A session, we'll have lots of opportunity to talk about what those services look like right now during COVID and how individuals can actually apply for either of the programs that have been mentioned. So I appreciate you all presenting, and I'd like to turn it over now into part 2 of our presentation to Hope Ministries. Ms. Janet Simmons is the president and CEO of Hope Ministries, and Janet will be presenting to us today. Janet?
Good morning, everyone. Hope everybody is well and staying safe during this time. Next slide, please. Currently, Hope Ministries is providing food through our food pantry. Originally, we have a client choice food pantry where our clients can actually shop for food, but because of the COVID-19, we are doing a drive-through on the corner of Beechwood and Wenburn for those living in the 70805 zip code and who have food insecurity. Next slide, please. So the eligibility requirements for our food pantry is that you have to live in the 70805 zip code, and you must meet the federal poverty guidelines for the income, and or you're receiving SNAP or DSNAP benefits. Those are the eligibility requirements for those shopping in the food pantry and receiving food through our drive-through service. Let's go to the next, when we're open. Thank you. So we are open right now on Mondays beginning at 8 a.m. and Fridays beginning at 8 a.m. And as the need increases, we will extend those hours to include Wednesdays at 8 a.m. as well. And that is our food pantry. We actually provide groceries. We have perishable and non-perishable items. And most families receive about 75 to 85 pounds of food, which is worth about $150 worth of groceries every month. And the eligibility, again, is you can shop monthly. Thank you. Now I want to talk about the Way to Work program. The Way to Work program is a sustainable workforce program. where we provide support for individuals and companies and people who are really wanting to retain sustainable employment. And what do we mean by that? That means long-term employment that can provide enough income for you to be able to provide for your family. So companies that benefit from this are companies who have a high turnover, who hire a great number of people, low to moderate income employees, who tend to have high turnover. And we work and do consulting with those companies to help them identify the areas where their employees have barriers. We work with the managers and supervisors to do training and help them with understanding their workforce. And we help with the retention issues for those companies. We also work with the company's employees. So they're line workers, they're people that are actually doing the work on the floor or wherever it is that they are. We work with them with barriers that they may have to help them sustain their employment while they're going through some challenging times. It might be issues with domestic violence. It might be childcare issues, transportation issues, all of those barriers that are barriers to employment. And so we work with those individuals, and our coaches work one-on-one with them as well to make sure that they are given opportunities to sustain their employment. Also, we do work with individuals seeking sustainable employment, people who are unemployed and want to have their essential skills really honed in, and people who want to really do a good job in their work and just need some help and some coaching to help them with that. So they're able to come through the Way to Work program for that. We do not have any eligibility requirements. So income is not a barrier to eligibility. Neither is your age or your, we don't have any eligibility requirements for the Way to Work program. Any SNAP recipients that are currently receiving SNAP or DSNAP are also eligible to help work with the Way to Work program. We have classes normally at our campus on Western Avenue. Right now, because of the COVID-19 virus, we have limited those classes and we are not having any on-site classes, but we are developing some videos that we can share with those who are seeking to increase their levels of employability. Next slide, please. So I've talked about all of this, corporate counseling, corporate consulting, and training, employee training, and one-on-one coaching. And the best way to get in touch with us is to either go to our website, which would be on the next slide, and or call our office and leave a message. Right now, we do not have anybody permanently at our office, but we are checking messages daily. And you have the email addresses as well for those who need assistance. My email address is there, and as David Tidwells, who is the Way to Work director. And otherwise, that's it for Hope Ministries. Thank you so much.
Janet, thank you. Thank you for the information that you shared. And again, Janet will be with us during the Q&A session to address any questions that come in. At this time, I would like to pass it on to our next presenter, which is part 3 of our workshop, Southeast Louisiana Legal Services, which is under the direction of Laura Tugel, their executive director. Laura is with us today, and Laura will be presenting on many of the support services that they provide, and especially are helpful during this COVID-19 epidemic. So thank you, Laura, for being with us, and I turn it over to you.
Okay, just to double check. Sometimes I get a little confused. So thank you so much for having me. I wanted to talk about different services that we're having through our nonprofit law firm. If you want to change to the next slide. Thank you. So pre-COVID times, we usually accept clients through a variety of ways, including online intake, telephone intake, partner referrals from community-based referrals, or people being able to call into the office or walk into our office. Our Baton Rouge office is located at 715 St. Ferdinand in Baton Rouge. And We currently are all working remotely and have been since around mid-March. We are a nonprofit law firm, but we only provide civil legal services. So we don't do criminal work, although sometimes we do assist in filing expungements to remove work barriers. So besides that, that's pretty much the only thing that you might not normally associate us with. So civil legal cases can be everything from domestic violence work, divorce, custody, landlord-tenant work, foreclosure prevention, a wide array of things that are on the civil side. Post-COVID, we did start a legal helpline. That number is 1-844-244-7871. Right now, it is taking calls from across our 22 parish service area. And we do have a pretty high call volume right now. So if you call into that line about a variety of issues that you may be experiencing, I'm going to talk about some of that in more detail in a moment. We will have one of our intake staff triage your issue, talk to you a little bit about what's going on, find out how urgent it is, get some good contact information from you. We want to know if it's okay to text you. So gathering some basic information, and then in turn we'll transfer your request to one of our attorneys. So it may take 24 to 48 hours from the time that the intake person talks to you before the attorney can get back to you. Some of the other ways to apply for our services, that particular line is only taking calls from 9 a.m. to 5 p.m. And you're not able to leave messages, unfortunately. But there are other ways to reach us. So we do have online intake. You can access that at www.sLLS.org. And that access is 24 hours, 7 days a week. But you don't get to talk to a staff member right away. You apply online, and then we get back to you the next workday with additional follow-up. Our Baton Rouge office is certainly also an option. That number you can call anytime also, although they're not going to get back to you except during working hours, and it's 1-225-448-0080. So what are the kinds of things that we are talking about on our COVID-19 legal health line? You're going to have to be eligible first for services to receive legal advice or beyond even legal advice. So the kinds of things, because of our funding, you have to be either a United States citizen or have a legal citizenship or legal eligibility status. So maybe you're a permanent resident alien, or maybe you have some other kind of legal status in the United States. There is a big exception to this requirement, and that's if you happen to be the victim of domestic violence or maybe human trafficking, and you're asking for legal help in a domestic violence matter or to escape human trafficking. So those are some of the limited exceptions we have to that requirement. Normally, our income eligibility for free legal services is 125% of federal poverty guidelines. We did have a little flexibility because of the COVID crisis to go up to 200% of poverty. So an example of that, and one of the previous presenters had a slide on this, an example of that is if you're a one-person household, your monthly income would be around $2,127 or below would make you eligible. An example of a four-person household, you would have to have monthly income of $4,367 or less to be potentially eligible for our services. And then the case that you're calling about has to be the kind of civil legal case that we can work on. So like if you slipped and fell in a grocery store and you're wanting to sue for what's called damages, that's not the kind of thing that we work on. So we're going to go through, next slide. Let's give you an idea of what kind of things you can ask for help with. So there's probably the two main things people are calling about right now. We are getting a lot of calls on the COVID-19 line for people that have questions about evictions. You know, a lot of folks have lost their jobs. They're not able to pay their rent right now. And they want to know what are my legal rights? My landlord's threatening to evict me. Unfortunately, in some circumstances, even though there's an eviction moratorium right now, you can't get into court. Some landlords have sort of taken matters into their own hands and have illegally changed locks, or maybe cut the utilities off, or engaged in other actions like that. We're also getting a lot of calls from folks who realize they may not be able to long-term afford their rent, and they're wanting advice about how do I go about breaking my lease with my landlord, or what kind of notice do I need to give to my landlord that I'm going to need to move out in the future. Questions about security deposits, just a lot of different sort of landlord-tenant calls we're getting on that line. Likewise, if you're a property owner and you're worried about, I may not be able to pay my mortgage because I've lost my job, or I've had a reduction in my earnings, we do have foreclosure counselors that can provide assistance to you on some of your legal rights. Maybe you may want to be considered for a loan modification, and you're just sort of wanting to know what are your potential options. We're getting a lot of calls on that. A lot of jobs closed down overnight, or at least temporarily shut down. So we're getting a fair amount of calls from people that are wanting to know, I didn't get my last paycheck. I would like to get it. So what are my rights there? And we've had a lot of calls from folks that are calling about unemployment benefits, and maybe they've been denied. And I think there's going to be another presentation in a couple of days, so I'm not going to talk a lot about that right now. But we are assisting with those kind of claims. Other kinds of public benefits denials, a lot of folks are having to apply for food stamps and need assistance with getting enough food for their families. Sometimes folks are getting denials for food stamp benefits, and so we can take a look and see if we can provide representation or guidance on those kind of issues. We're getting some calls, though not as many as we expected, from people who have had changes in their income, and they're needing to request a change in their child support amount that they pay because they're no longer getting the same amount of income that they previously were. And then we're getting a fair amount of calls from folks that have custody issues, custody orders, where they share visitation with another parent, and they are very concerned about having their child go back and forth between two homes because of the public health issues. So we're taking calls sometimes from a parent who doesn't want to allow the child to visit, and then sometimes we'll get a call from a parent who's being denied visitation. And these are the things that we're seeing the most right now. Next slide. What we think we'll be seeing in the future, in the not too distant future, a lot of folks are unfortunately having to run up credit card debt. So in a few months from now, we may start having folks calling us about collection lawsuits or maybe even bankruptcies. So we think that will come a little bit farther down the line. And then unfortunately, a lot of folks have lost their life. So we're getting some calls from family members that are wanting our help with filing what we call successions in this state to try to deal with the assets in their community, in their family members' estate. Some people are calling us wanting help doing wills because they are very concerned that something might happen to them as a result of this health crisis. So a wide variety of calls that we're receiving. So what is a particular legal issue that someone is calling her about is not related to COVID. Yes, you can still call us for help. we would ask that you call 1225-448-0080, which is our Baton Rouge office number. And then we will see if we can assist you. And so some of the other kinds of cases, you might be needing to seek a protective order in a domestic violence case, a divorce or custody issue that really isn't related to COVID. You may have some other kinds of consumer matter not related to COVID. And we also have a statewide low-income taxpayer clinic. We don't really prepare returns unless that's part of your tax dispute. The IRS may be sending you a collection notice. Maybe someone else claimed the earned income credit and you really feel like you were entitled to it. Those kind of things where we try to work something out with disputes with the IRS, and also successions and wills that aren't related to COVID. We're still taking calls for those kinds of matters. Next slide. Or is there a next slide? Thank you. One last thing I will mention, I just sent something. We have been doing some Facebook Live sessions with our staff, and we do have one this afternoon at 1 o'clock. And it's about the stimulus checks, like trying to answer questions. I do want to mention one deadline that has come to our attention that got announced yesterday regarding the stimulus checks. So this is either the $1,200 or maybe the $500 per child, or the $2,400 if you're a married couple. These are the checks that are coming out from the IRS as a result of the CARES Act. So the IRS announced yesterday that if you are receiving Social Security or SSI and possibly VA benefits, and you have a child or minor that lives with you, you actually have to take action by tomorrow to add that, to go into the IRS website and add that person if you want to try to receive those additional funds for family members. And that will be covered in our Facebook Live session later this afternoon. So thank you so much for having me.
Thank you, Laura, for addressing that and for sharing that additional information. At this time, we will start our question and answer session, and I'd like to invite all of our panelists to unmute their phones, and we will go into the Q&A portion. I have a first question that is going to Ms. Danette Brown. An individual is saying, what do I need to do if I want to find out if I am HIV positive now that COVID is here? Do I have to come into a clinic to see my doctor?
Thank you, Dr. Jones. Good question. No, you do not have to go into the clinic to see your doctor. Our funded clinics, Our Lady of the Lake, Care South, and Open Healthcare Clinic all have video conferencing or telemedicine options available if you need to see your doctor. Those clinics can also have you to come in if you like with practicing social distance, and you will be provided with PPE, protective equipment available if needed. But no, you do not have to go into the clinic or the medical doctor's office if you don't like. You can be seen via video conferencing or telemedicine.
Excellent. There's another question that's here for Ms. Shamel Levine. You mentioned the documents that were needed for the Office of Social Services. Shamel, could you elaborate, pardon me, specifically on those who are wanting to apply for rental assistance to pay their rent, what documents are needed, and then also individuals for specifically their utility bill, if they're having trouble with that right now, making ends meet. Shamel?
Sure, Dr. Jones. So for documents needed for rental or mortgage assistance, we need a valid picture ID for the head of household. Of course, you have to live in East Baton Rouge Parish. We also need Social Security cards for everyone in the household, proof of income for every household member, late rent or mortgage notice or an eviction notice, proof of all household expenses, and proof of hardship. Of course, that'll be easy, if you've lost your job due to COVID-19. We'll just need separation papers or something showing that you had a loss of income. In terms of utility assistance, the same documents are needed. If you're asking for a crisis assistance, we would need a copy of your disconnect notice. If it's non-crisis, a copy of your current utility bill. In terms of proof of income, we would need the income of every household member. That could be a Social Security statement, check stubs, the last 4 check stubs, unemployment income, or documentation showing that you don't have any income at all. For Social Security, the Social Security cards for household members, in the past, we needed to actually see the Social Security card, but because of COVID-19, Louisiana Housing Corporation has relaxed the guidelines. So if you don't have all of the Social Security cards, we can use just the Social Security numbers for now. So those are all of the documents you would need for rental and mortgage assistance, and then utility assistance.
And again, Ms. Shamel, if you could explain, you're using the average out of how many months in order to be able to provide them with that support?
So for utility assistance, we would need the last 4 check stubs. So if they get paid every week, we would need the last 2 months.
Okay, good, thank you. The next question is for Ms. Nina Hunter with Employee BR. And it's a 2-part question. The first part, Nina is asking, how can they apply for Employee BR services? Is that available online now or not? And then how long would that process take? Could you share, Nina, what's happening with the application process?
Absolutely. So at this time, we are not accepting new applications, but we are hopefully anticipating to be able to start accepting new applications at the beginning of May. But obviously, we will have that information posted on our Facebook page, our website, and all of our other avenues that we have to get information out. Because our case managers are all working remotely, they will be able to process applications in the standard time. There may be a little delay in that because case managers are having to still deal with paperwork to a certain extent. But applications will be able to be received. The goal is electronically. And that's what we're working on. And we're waiting for those updates to come any day now. So as soon as we're able to receive applications fully electronically, then we will put that information out. So at this time, we're not able to receive those applications, but we're very much working towards that, hoping to provide those updates any day now. But once we do receive those applications, normally what happens is once that application is received, you'll be contacted by an Employee BR case manager within about 5 to 7 days.
Okay, and just as a follow-up to that question, Nina, so if I were a current client of yours who had been a part of Employee BR, are services still available and our case managers still supporting those individuals?
Yes, everyone who was already a customer or Employee BR customer are currently receiving services and are able to access the Employee BR case manager by phone and email. They've been having video conferences, they've been sending emails, and they've been communicating by phone.
Okay, excellent. Thank you. Our next question goes to Janet. And Janet, this question is about additional information on the resources you provided. Where should they actually go to get these particular resources in Baton Rouge or the surrounding parishes?
Okay, so one of the places that is a common place that people receive resources is from the 211 hotline that's provided through the Cafeteria United Way. And they have information about not just the East Baton Rouge Parish, but also all surrounding parishes that the United Way serves. So if you have a need for food, for example, the Hope Ministries pantry only serves individuals that live in the 70805 zip code. But what if you live in the 70802 zip code? Or what if you live in another 70815 zip code and you need food? You can call 211 and the counselors on the 211 hotline will be able to provide that information for you so that you can get that resource. Same with workforce resources, same with any other resource that's available in our community. And the United Way does a really good job of providing those for us and through this 211 hotline. So any resource that anybody needs, whether it's seniors asking information about how they can get support, disabled people that need support, or anyone else that needs any kind of support can call 211. It's just like 911 or 411, but it's 211, and it's a great resource to be able to tap into while you're wondering how you're going to handle a situation that may have arisen that you didn't know what to do with it. So again, it's 211, and wait for the person to answer the phone, the counselor. You may have to leave a message, but they will get back with you. And make sure that you know what your zip code is when you do call in.
Excellent. Thank you, Laura. Pardon me, Janet, for that. Laura, the next question is for you. And you talked about a lot of the services that are available. Where can an individual find information about hot topics that you discuss, such as eviction? We know that's a big one. Foreclosures, unemployment compensation, which you're right, we're going to touch on that on Thursday. But where should they really go for these critical topics, especially if that's happening to them right now? And again, this question is for Laura.
Is our own website, which is www.sLLS.org. And another one is louisianalawhelp.org. So it's www.louisianalawhelp.org. And we have been, along with some of our other colleagues, producing a series of informational one-pagers on a variety of topics: evictions, foreclosures, disability benefits, stimulus funds, a lot of different hot topics that folks are really interested in looking at. And those resources are available to anyone. It doesn't matter what your income is. Anyone can access that information. Another place that you can check out, we have our SLLS Facebook page. So if you know how to get on Facebook, you can go to put in Southeast Louisiana Legal Services, and a lot of our Facebook Live sessions and other resources we are posting there as well. And so we've had for our first eviction topic that we did on March 31st, we had over 4,300 people join that particular Facebook Live session, and we were able to take live questions to some extent through that and then respond to people afterwards. So those are a few places you can look at. And there is one other resource that you could consider, which is called Free Legal Answers, and it is done through our State Bar Association. And if you have access to the computer, you can type up a question and they will get an attorney to respond to you, but you never talk to the attorney. It's all done through email, and that's available as well.
Thank you. Thank you, Laura, for that. So I want to invite our audience that's listening or that's on to actually provide questions through our chat box also. I have a question that came from the online chat, and they're asking specifically about whether this information would be available to college students and what's the best way to get this information out to them. And so I'd like to mention that this particular group, this demographic of students, is an important one to learn about financial literacy, particularly the article that I alluded to at the beginning of our workshop. We know that this particular demographic of college students is actually scoring even lower than C. They actually are at a D level in terms of understanding and knowledge when it comes to how to best handle their finances. And so as a result, this presentation will be available on the city's website, along with all of our previous workshops. We'll have those that were recorded. As I mentioned, we're also live streaming, so this can be shared in addition, so that you can share this with different loved ones, family members, college students. But to our panelist participants, what other suggestions would you have, not just for sending this to college students, but also just to others who you know are in need of help in this area? How would you like to get that information out?
This is Laura Tucker. One thing that we're really wanting to explore, because not everybody is savvy, so we were wondering about the possibility of sharing flyers that could possibly be distributed at some of the food banks to make folks aware of services, because not everybody can access the online ways to get information and to request help, but most folks can manage a telephone line. So that's one thing that we're thinking that we would like to do.
Excellent. Thank you. And I think you brought up a good point, Laura, is that everyone, even during this COVID time, we recognize that everyone doesn't have access to internet services or also to a laptop at home. And so we do have to be creative in how we circulate the information that we provide. So let's go to another question. And this question is for Ms. Danette. Danette, this person is saying that they actually have HIV. Where should they go right now for services? This is a critical question and a critical time for that individual to try to get the most resources available to them. What should they do? And I think thank you to unmute. Ms. Danette?
Okay. Am I unmuted now?
You're fine, thank you.
So for the question, the person who's HIV positive and where can they go for services, they can go to any of the 6 agencies that were listed in my slide, which are Open Health Care Clinic. They can go to Heart, Care South, Our Lady of the Lake, Family Services of Greater Baton Rouge, or they can also go to Crescent Care Legal Services. They can go to any of our funded clinics or community-based organizations to seek services. There are all of our agencies are fully functional at this time, and they are open. They do have, some of them are not open to the public, which are Family Services and Volunteers of America. But if you go there, they will not turn you away. They will try to answer any questions that you have and connect you to a clinic on today. So you can go to any of those agencies. You can also call. I know when the slide deck is posted, they have a website with information available. You can go to those websites as well. Or if you need additional assistance, you can contact our offices. You can contact me at 225-358-1962. We check messages all throughout the day, and I can get you connected on today for assistance.
Excellent, thank you for that. And we'll make sure that those phone numbers that you provided to the clinics, that will also be included on what we post online. Thank you. Okay. This next question is for Shamel, and the question is reading, When do you anticipate that you'll begin rather to accept applications for assistance in light of new grant funds? When do you anticipate you'll begin to accept applications for assistance in light of new grant funds?
So we're hoping to get everybody trained within the next 2 weeks. And so in the next 2 weeks, we should be assisting individuals with energy assistance. We have some funds currently available for rental and mortgage assistance. There is a limit to it. At this point, we're not exactly sure when we'll get the CARES Act funding for rental and utility assistance. Well, under CSBG. But we do have LAHEAP funds. We just need to be able to assist clients remotely. And so we're looking to do that within the next 2 weeks.
Okay, excellent. Thank you. I'd like to go to Ms. Hunter. There's a question that is here. Is there a list of all the possible training programs that you mentioned? Where should someone go to gather that information, Nina?
So that information is available at employerbr.com on our website. Once you click on the link and you click on the link for individuals that are seeking assistance with employment or training, you'll see a list that says eligible training providers. And you'll see an updated list that shows all of the different schools that we contract with where we can provide tuition assistance.
Okay, thank you. We have another question that came in from a viewer, and they were inquiring about on the chat room to find out what other webinars or resources are being provided at this time. And so Louisiana Bankers Association has a list of financial literacy resources and links that are available to professional development webinars. In particular, if individuals are looking for how to change their financial life, there's an online webinar that they can also tap into to get more information. And again, it's called Time to Change Your Financial Life. Let's go to another question for Laura. And that question has to do more about the services that you mentioned. Laura, you said that those services are free. Does that mean that individuals do not have to pay anything for the legal services that your nonprofit provides?
Services, not charge anything for those services. However, sometimes to file something in court, there may be a fee that a court charges. So a filing fee to file a certain matter or to have that served on the adverse party. Occasionally, there are ways that folks with low income can request a waiver of those fees, but not everybody will be eligible for that if they meet our income guidelines. So we never charge anything for our services, but occasionally a client might have to pay a fee through the court system or either to like record a judgment in the clerk's office or something like that.
Thank you for that. Thank you. This question is coming to Janet Simmons. And Janet, the workforce development program you referred to earlier, is that available for anyone in the community? Is that just for low-income individuals? Who's able to apply for that?
That is eligible for anyone in the community. They're eligible. We don't have any restrictions because we have a diverse funding source. And so if somebody comes in, for example, that meets the federal poverty guidelines, we would use the money that we get through DCFS, SNAP employment and training program. But then we also have private funds that come in that have no restrictions. So we're open for anyone that needs to have sustainable workforce solutions to be able to apply and come in and receive coaching services from our coaches.
Excellent. That's great. Thank you. So ladies, I'd like for each of you to be able to address this last question collectively. We'll go through each of you to answer. And that is, what personal advice would you give to a person who has now been faced with financial challenges as a result of COVID? And why don't we start with you, Janet?
Well, that's an interesting question. I guess the first thing I would do is do not feel bad about seeking advice from others who know more than you do. It's not a bad thing. There's no shame in it. And just that's something that we're here to community, take advantage of those resources and don't feel frozen. So in other words, if you feel like you're frozen or you're depressed or you're not able to do anything, pick it up, pick up the phone, call, we're here to help.
Great. Ms. Shamel, if you could address the same question.
So I would echo what Janet just said. Don't be afraid to call us. Don't be afraid to reach out for help. We're here to help. We're all in this together. We're all at home. We're all, trying to stay healthy, and just reach out for help. We're here.
Thank you. Nina Hunter.
I agree with those sentiments as well. I think one of the biggest problems we have when we're dealing with trauma and stress and in processing things in a pandemic is we don't know where to go, to ask for help. Even if we want to know about that, we don't know a service is available. And a lot of times you're finding out because you talked to, someone else, but we didn't do, as good of a job as getting the information out. So I encourage everyone who's on the call, even if you have one number, call that number, because that person who answers the phone is probably going to know who to send you to, even if that's not what that individual does. We've been getting tons and tons of calls for people who just want someone to pick up the phone at Employer BR, because we're picking up the phone and we've been a resource to connect them to who they're trying to get to. And I think that's probably the big thing, the big component that we've been able to add at DHDS is that we're still open, so people just call us and we can connect you, even if that's not what we do.
Excellent. Thank you. Ms. Danette, would you like to add anything to that?
Yeah, I would just like to add that you're not alone. You're definitely not alone. This is an unprecedented emergency. And, if someone's out there, you may feel like you don't know what to do. And just like Nina said, you have people who are going to access resources who've never accessed any type of resources before. Our society is fiercely independent. And so I say, to anyone who's going through that, ask questions to that neighbor who you haven't spoke to, ask questions when you go into the grocery store, and to aggressively pursue what you need in order to have your family safe. Ask those questions, realize that you're not alone, but also if you need to talk to someone, if you need to talk to a social worker or a counselor, they do have systems available and hotlines in place for those individuals, and do not feel like you're in this by yourself, because you're not.
Excellent. And then lastly, Laura, I know you deal with so many people calling you, and especially during this difficult time, you're seeing a lot of people probably who have a lot of anxiety when they're coming to you for legal questions. What other types of personal financial advice would you give to them during this time, Laura?
Of and repeating what other panelists have talked about, to ask for resources and to, unfortunately, this is not news that anybody wants to hear, but it's definitely news you can use. It's going to be a long time that we're all recovering from this. And asking for resources, and you're going to have to prioritize what is the most important thing to get you and or your family through the next weeks, the next months. So definitely, if you hear that you can't pay your mortgage and you hear that there may be a program that your lender may be providing, definitely explore that. It can be really difficult, whether the disaster is from a flood, or it's from a public health emergency. Just the level of information coming at you all day long, it's a lot of information. And sort of taking it, you don't have to do everything today because you may get overwhelmed. So figuring out what is the thing that I have to deal with today, and then asking for those resources. One thing I want to say is, even though there are executive orders in place, keeping a landlord from evicting or a lender from foreclosing or something like that, at some point those will go away, those temporary moratoriums.
Mhm.
That doesn't mean that you don't still rent or that, you're not going to have to work something out. So, if you need to, your landlord would probably at this moment rather get something than nothing. So if you offer something, that might be a really helpful thing to kind of get you through a future bad patch you may have. So pacing yourself, communication, asking for help. I think all of those things are really important because it's going to be a bit of a marathon here.
Okay. Thank you for your honesty in answering that question. I appreciate that. And I know a lot of people need to, as we started off earlier, is being able to get reliable information, honest information from reliable sources. So I appreciate your response to that question. So ladies, at this time, I'd like to go to the next slide. If our host would change the slide to our next one. We've talked about so many resources that are available on a financial level, individuals who need help with paying rent or taking care of a utility bill, or also medical information, as Ms. Danette shared, for our very compassionate community that is dealing with HIV. But we also have individuals who are faced with stress in dealing with a lot of trauma. I know that this epidemic came as a surprise to everyone. And so all of the individuals in our community, you'll find when people meet and greet one another, they'll say, how are you doing? How are you handling this? And so if anyone is going through or facing stress during COVID-19, I want to inform them of an internal service that we have through the mayor's office, and that's our RECAST program. It's RECAST Baton Rouge Resources. And RECAST works with a coalition of partners in anything from the Children's Advocacy Center, which is with BRAC, a part of BRAC, Capital Area Human Services District, Family Services of Greater Baton Rouge. The phone numbers are listed on the screen. IRIS, which is a 24-hour crisis line for those who are dealing with domestic violence, any sexual trauma and awareness that needs to be addressed. The phone numbers are listed there. And then also the Butterfly Society, which is another partner that does great work in our community to help domestic violence, both women and men who are faced with this. And we know as a result of this epidemic that these numbers have increased because people are at home. And so I wanted to be able to provide you with this number, with the numbers, the resources, and also to share with you that through the leadership of Dr. Joyce Plummer, this coalition is operating. You have access to Dr. Plummer through the mayor's office. Please feel free to reach out to her and to her staff. They do some amazing work and have some incredible partners that are truly providing resources throughout the community. And so I just wanted to share that with everyone. The information is also listed down at the bottom in terms of websites. so that individuals could go to it. If we could, let's go to our final slide. And before I talk about the remainder of our April financial literacy workshops, I do want to mention that there is another resource that's available, and it's a list of guidelines of resources that are available throughout the Baton Rouge community. And I do have permission for us to post this on our website. And so we'll be listing the Baton Rouge Community Resource Guide. And this contains anything from general information, which is provided by Capital Area United Way, which is one of our partners. We also have information in this guide, which is about internet or cell phone resources for those who need perhaps a lower fee to be able to gain these resources or services. As I mentioned already, domestic and even dating violence, IRIS, that information is included in the guide. Educational resources, anything from childcare to education information. Also for emotional support and mental and behavioral health, the guide gives different organizations, for example, the Family Services of Greater Baton Rouge information is listed there. Another area is also for food. 3 o'clock project, which is providing food. And of course, our East Baton Rouge Parish school system is still providing food for our children and the families from the schools that are no longer in service right now. And then, as we mentioned, our own Hope Ministries that is on the call today, their food pantry. So this guide is very helpful. We'll make sure that this information is available to everyone. I also want to conclude by reminding everyone that our financial literacy workshops are ongoing. On Thursday, we have our 4th workshop, which is breaking down the unemployment surges. A lot of individuals are being impacted by this. We have an incredible special guest that will be talking to us about the impact that has hit both small businesses and large businesses, but just overall the impact of unemployment to the community, along with other speaker partners that will be touching on the topic. We'll give some overview and guidelines, and also have a video from LWC showing how to actually file for unemployment. Our 5th workshop is on April 28th, next week on Tuesday, and that is creating a game plan for an emergency reserve. Many individuals are questioning, how do I even go about doing that during the time of not being employed? But we have some step-by-step tips and also suggestions even for after post-COVID, and how to really establish this, and what accesses do you need to have right now, and how to start small. On April 30th, our final workshop will conclude on Thursday. And this one is somewhat of a summation of all of our workshops, but we also will touch on spending habits during COVID and beyond. Many people are getting the stimulus checks that we began to talk about. We want to ensure that people are prioritizing and budgeting those funds so that they allocate them to the proper payments that need to be made, whether that's bills or paying down debt, or even creating their resources for them. And then what do you do with this new normal of money management? So these are the particular, workshops that we have coming up. But I want to leave just a moment to invite Ms. Vernadine Mabry to touch on another important aspect that is happening within our community. Ms. Vernadine, would you please share with us about the census and how that is impacting the Baton Rouge area right now, and what our community needs to do? Ms. Vernadine?
Thank you, Dr. Jones, and what a great workshop. I just want to stress the importance of responding to the 2020 census. The decisions that we make today will impact our community for the next 10 years. So all the programs and services that you will share today from DHGS, they are directly attached to the census response that was given 10 years ago. Surely today, 10 years later, that need is ever increased. But if we don't respond, it determines how much money gets into our community. I cannot stress the importance of responding to the 2020 census. So while we're all adhering to the governor and our mayor's stay-at-home order, take 10 minutes just to respond to the census. It really is just that important, not only to us, but to our community. Dr. Jones?
Thank you so much, Ms. Bernadine. Excellent. Thank you all, ladies, for the information that you've shared today. I want to thank each of our partners that continue to be with us. Again, this information will be posted on the city's website, and we ask that you continue to register for workshop number 4, which is on Thursday. Again, dealing with unemployment. Thank you all for being with us, and we look forward to seeing you on Thursday. Take care.